According to a the year 2019, study in the Journal of Pediatrics, the incidence of anxiety, behavior disorders, and mood disorders in adolescents had doubled over the previous decade. That's like unbelievable. Doubled in 10 years. 100% increase. Doesn't that qualify as an epidemic? And that's before COVID. According to the CDC, the number of children with ADHD increased by 70% in 20 years, and it's now at 13% of kids in the typical age. Some predict an incidence of 50% of ADHD within 25 more years. That's just like phenomenal growth, with effects that I maintain are far worse than those of, say, COVID. People vastly underestimate what happens to a child who is given a diagnosis of ADHD or another mental health problem. Often, for the rest of their lives, here's what happens when they get a diagnosis. One, they're labeled and thereby separated emotionally and physically from kids who are not labeled, normal. Two, they use their diagnosis as an excuse for the rest of their lives, so they don't ever have to be responsible for what they do or what they feel. Now, yes, sometimes they really do have a diagnosis that affects their behavior. I get that. But it is far more common for their diagnosis to be wrong and for it to be then used as an excuse. Three, their parents use the diagnosis as an excuse so that they don't have to do their own work in learning how to love and teach their children. In other words, accepting a diagnosis of ADHD or any of many behavioral disorders can be a terrible mistake. An increasing number of healthcare professionals are recognizing that these following factors are not being recognized. This is from professional journals. One, mental health professionals are diagnosing the children with mental health problems without even assessing what role the parents might be having. Unbelievable. That's like diagnosing a problem with plants without referring to the soil they're in. They dispense pills, they prescribe behavioral therapy without even pausing to suggest that parents are the ones who need to learn and change. Nobody even mentions it. Again, it's like taking care of plants without thinking about soil and water. Two, the diagnoses are being made by a wide variety of therapists with a great variety of training, some not so thoroughly trained and not so skilled, a great many not so skilled. Three, the criteria for these disorders are often very vague and loosely applied. They're not concrete. They require judgments that the professionals are often not prepared to make, especially in the absence of parental evaluation. Four, mental health care professionals have to make a living, so they benefit from diagnosing children with mental health disorders. This is something that's being talked about a lot more. Five, none of these mental health care professionals or parents has the slightest understanding of real love. So children are being assessed as having a diagnosis when the only real problem in almost every case is simply a lack of love. Everybody is missing the real problem, and I mean almost everybody. So briefly consider the following questions. Psychologists diagnose children, but do not diagnose teachers and curriculums as, for example, insufficiently interesting to maintain attention. So if you're not looking at the curriculum and the teachers, how can you say it's the child's fault that he's not paying attention? Before you treat a child with powerful stimulants, you might ask whether a debilitating lack of love and teaching at home and everywhere else would give you 6 varieties of inattention too, and probably qualify you with a diagnosis of ADHD or anxiety or whatever. Another, the grab bag of supposed symptoms of the disease amounts to a description of the average child's behavior in the average classroom before the era of school psychology and making all these diagnoses. For example, often fidgets or squirms, often leaves the seat, often runs about, often talks excessively. Those are not symptoms of an illness. Those are symptoms of being a normal human child. And then if you add pain, what child wouldn't do that? Do we even think about that? A third question to ask. Are we enforcing reasonable behavior by medication? Are we parenting by pill? Is another way to say that. School psychologists may not themselves prescribe the medication, but often encourage its use, and they direct parents to physicians they know will prescribe. So in effect, they're putting your kids on medication even though they're not sufficiently qualified to make the diagnosis and don't even care about the effect of the family on the child. The diagnoses provided and the medications encouraged by child psychologists are devoted largely to what? Making a happy child? No, to getting children to sit quietly and still. Well, I can do that with morphine too. Goals formerly pursued by, for example, the cane in the old days, or rapping knuckles, or yelling and screaming. Now we're just doing it with pills. We don't hit them, we just drug them. It's a new form of school discipline, one that leaves parents certain that their children are diseased, and that quickly leads the children to the same conclusion about themselves. The mental health field is labeling children rather than helping them. They're controlling children rather than thinking about their mental health. Happiness isn't even a consideration. As parents, it's our responsibility to build our children's mental, spiritual, intellectual health, not just to control them. We can learn to do exactly that, which is what you're doing right now.